So, Jeff, thank you so much for coming on the show. I really appreciate you coming on and sharing your story. So go back with me, and when I first saw you, tell me about what you came in for and what kind of transpired along the way.
Yeah, I was referred to you by a counselor.
Colleen.
I knew that I had some medication that had kind of, my anxiety and depression had broken through. I'd been on that medication for a dozen years, and things had just gotten off. My brain chemistry was off, and I knew it. I was experiencing extreme agitation and anxiety. My hands were shaking. I mean, it was just one of those things where it felt really acute. And so when I came in, I explained how I was feeling, and you told me about the protocol. We tried a couple of different dosages, and I started feeling better. But then not so much. And so it took a while, but we got it dialed in. At the same time, while I was struggling with the way that I was feeling and just feeling so agitated, I was doing. I was trying more meditation. I was more regular in terms of prayer and reading scripture, and then when we really got things dialed in as far as the medication was concerned, and I started feeling normal again, I tried to continue those habits, and today, it's remarkable how I can feel so good. Again, I mean, honestly, when you told me we're going to get this dialed in and you're going to feel great, I was dubious. I thought, I just want to be able to get through the day, and I don't think I'll ever feel great again. But I do feel great, and I'm really thankful that we worked together and discovered the solution.
Now, when I first saw you, I know Colleen sent you in. It was a therapist I've been working with for many years. What were you taking something already from another doctor?
Yeah, I had been on Prestique for a long time.
Wait, weren't you on Lexapro for 20 years?
Lexapro, I probably did for 15 years, and
right.
then maybe a dozen years after that.
Right.
Prestique.
Right there. Let's stop right there.
And only medications.
Yeah, stop right there. So you were on Lexapro for like a long time, years, 15 years. And then why did you switch to Prestique at that time? And how was Lexapro performing during those years?
It performed well in the beginning.
Mm-hmm.
And as I described before, it just kind of got to the point to where what used to be working wasn't working anymore. And
right.
My anxiety was breaking through. The behavior that would be caused from that would cause me to go into depression. And so a psychiatrist recommended that I try Prestique, and it worked for a number of years. But then when I came to see you, it had been several months, and I just was having those anxiety attacks, and the irritability would lead to acting out in unkind ways, and then that would cause me to fall into depression. But by the time I got to you, the anxiousness was so over the top. It wasn't so much, it felt like I was losing my mind, but it felt like I was losing control of my whole being. And that's what we deal with. And that's the beauty of having a treatment, that we can get a handle on that.
So now when you came in, you said that you were on Prestique when I saw you, and you're feeling irritability. I think we talked about maybe the irritability might be coming from the Prestique, right? Is that what, if I remember that right?
Yeah, if I remember right, you said that it wasn't that uncommon. And so, the irritability was was irrational. The things that I was experiencing in my brain and the perception that I was having was that, everyone in my life, especially my wife, were being complete jerks to me, when in fact it was the other way around.
Yeah.
And so, Julie would say things once we got the medication dialed in. She would say, "Boy, it's nice to have you back."
Mm-hmm.
And I didn't take that as sarcasm. I mean, it was very affirming.
Right.
And it's amazing. You and I talked about, I said when I was not doing well, I would just say, this can't be normal. I'm responding to stimuli in a way that it's not merited. And you pretty much said, yeah, that's what everybody experienced.
Well, that's what it's not what everything. Unfortunately, it's not what everyone experiences. It's what everyone's supposed to experience. It's a sense of normality, and I explained in the show about normal is a balanced state of being in your system. That's normal. Mm-hmm. And again, even though Pristique's my favorite, I think in your case it was a little bit you had a little bit of irritability. Didn't you try Abilify also? And did you try?
I tried Abilify, and that just
didn't work.
Was the wrong thing for my system. I would get the shakes. I would get the jitters.
Right.
I had sewing machine leg.
Right.
And complained about that, and you said, "Oh, well, that's just the medication." So
yeah, and I think that was the doctor before you saw me put you on Abilify, right?
Yeah.
Yeah.
And too much of it. All at once.
See, what they were doing there is they were reading that with the irritability from the Pristique, and when you said you felt kind of a bit irrational at times, they were thinking that you had a bipolar component, and it ends up you didn't. Yeah. You didn't all along.
I think I used the word paranoid.
Right.
And I think that might have triggered that diagnosis.
That triggered the diagnosis. The diagnosis was wrong. So the triggering was actually just a side effect from medication. And even though Pristique's my favorite, it's not for everybody. In your case, it wasn't. So I identified, and I thought, you know what, a mellower one is Cymbalta. So that's why I switched you to Cymbalta, because I thought, the thing about it, I'll explain after I talk to you about on the board about, but basically Pristique works a little bit more on norepinephrine, and I think that was a little bit too much for you, and Cymbalta is more balanced. It works a little bit more on the serotonin side than Pristique does. So I think in your case, it was just a better balance. And then I think
those two things in combination, I think, are really what dialed it in.
Well, I think it was the addition of the Wellbutrin and then getting rid of the Abilify, of course. But the addition of the Wellbutrin, what that did is that really boosted get you out of the depression and help your motivation, energy, and so I think that's it. You're just on those two, right?
Just those two.
Yeah. That's all you need. That's all.
Amazing?
It's amazing. And, they're going to be long-term meds, but so what? I mean, it's, the what you're feeling now, by the way, it's never going to go away. So you're just going to have to get used to feeling normal. That's just going to be the rest of your life. That way you have to, and so just the best thing is just like, I'll take it, I'll take normal any day.
I'll take it. I'll take it. Be able to go through life and do the things that I do without having to talk myself off the limb all day.
Right. And anxiety disorders are the most common diagnosis I see in my practice, by far, actually. Depression's number 2. But the reason that the anxiety disorders is the first chapter of my new book, The Corona Protocol, is a reason. I tackle that right away, the first chapter, because it's like that's what people need to start with. People need to start with this disorder because people have to realize that there's hope. And it's miserable. You tell me. I mean, I don't have to tell you. It's miserable dealing with anxiety. It sends people to the emergency room all the time. It makes you think you're going crazy when you're really not, but you feel like it. And it's just a terrible state of being. And and people say it's just like it's a torture. It's like a silent torture.
When you're complaining to yourself, I can't keep living like this. I mean, that thought process goes to bad places.
Right. Exactly. So, well, thank you so much for coming on the show. I really appreciate your and it's been a pleasure. It's been a pleasure working with you and
radical impact that it's had on my life.
Well, this is why I love doing what I do. With what's happened with you and many of my patients, is why I do it. I mean, that's why I gave up family medicine years ago and moved into this full time, because I just feel like I make much more of a difference doing this than I did being a family doctor. And because I just wasn't getting the satisfaction of seeing things like what's happened to your life. And since I see it so often every day in my practice, I see it. It's just, it's fun to come to work because I love what I do. I have a passion for it because I love to see the results and I love to see people's lives changed.
Well, I'm a perfect example of that.
Yeah. Well, thank you for coming on, and we'll talk to you. I'll talk to you soon then. Okay.
Great.
Okay. Thanks, Jeff.
Bye.
Appreciate it. So in his case, he's interesting. So he's a little bit more subtle than this is where doctors have to really pick up on the subtle details. Again, came in with Prestique, my favorite, statistically the number one medication I prescribed in my practice, but it wasn't for him. Actually, it was for a while, and he switched from Lexapro, again, 15 years on Lexapro, and actually it worked well with him. It didn't give him side effects, so he was getting serotonin that way, which is good. But then it started to wear off, and then actually serotonin is here, but it started to wear off, and he wasn't. And so then he put him on Prestique, and he was doing great. Why? Because of the norepinephrine. So that's why those two are key. And the norepinephrine is really, really important for results, anxiety reduction. Not only that, also physical symptoms like pain. So again, what I talk about a lot in my book is this mind-body connection, that when you balance norepinephrine, that it helps you emotionally and physically. So neck and shoulder tension, back pain, headaches, stomach problems, irritable bowel, fibromyalgia, all the things that we physically see get better when you balance norepinephrine. And I discovered that like 30 years ago when Effexor came out. This is before Cymbalta, before Prestique. Effexor was the only one, the SNRI, it was the only one for about 10 years before Cymbalta came out as the second one. And so I saw a lot of experience with Effexor, but again, it's more norepinephrine. Now Cymbalta is different. It's the same class, but it's a little bit stronger on the serotonin site and a little bit weaker at the norepinephrine side. So it's a little bit more balanced between those two chemicals. And now, and some people will, more often than not, people prefer Prestique over Cymbalta, but not everyone. A lot of people, Prestique's a little bit too intense on the norepinephrine side, like I said. So Cymbalta's a little more balanced. But some people, Cymbalta might cause fatigue, sometimes sexual side effects, sometimes some of the serotonin problems, but not as much as like Lexapro and Zoloft and Prozac and the rest. And in his case too, he had some depression. And so I add some Wellbutrin, and boom, now he's got dopamine moving, and now he's doing even better. I tried upping the dose to 300. The average dose, it was too much. It made him feel restless. So again, the norepinephrine and dopamine, he's really sensitive here. So he's on the lowest dose of Wellbutrin. He's on an average dose of Cymbalta. So it's just the subtleties of knowing how to balance those three chemicals. And that's where my experience comes in, is knowing how to do that, how to adjust things perfectly. And now he's at a perfect level. Average Cymbalta of 60 milligram, average Wellbutrin of 150. He's doing good. And he'll do good long term. We probably won't have to make any adjustments, at least for a while, but likely actually not, because now he's dialed in. We've got the right formula together now, and he's gonna do good for long term.
Hello.
Welcome. How are you?
I'm great, Dr. Corona. How are you?
Good. So let's see. Last time I talked to you, things weren't great.
Yeah.
So tell us what happened and what led up to our last visit.
Well, what led to our last visit, a few things going on at work, and just they got very overwhelming, and it was kind of company-wide. A lot of other people were feeling it too, but I was extra sensitive to it. And thankfully, my boss, who also suffers from depression and anxiety, kind of called out my sick days, and he's like, you need to go on FMLA and take, correct yourself, go see your doctor and try and figure out what's going on. And so that's where we ended up a couple weeks back talking about my adjustments to my medications.
Well, I'm saying, I mean, that's great that you have a boss who understands. There's many out there who don't get it, and they think, oh, you're just weak. Because I know you. I've known you for many years. You've been a great patient, but I know like how intelligent you are, what a hard worker you are. You work at a very high level, and you're a great employee. So I think the fact that someone understood that, okay, there's something not right here. This isn't you, and it wasn't. It wasn't. It's not you. It's not what defines you. I know you much better than that, and that's just when you were talking about those things, I thought this is not the person I know, and so. And let me see, what were you on? I know you're on the Adderall, right?
And yes, and Effexor
75, and you were on Wellbutrin 150, then Abilify 10, right?
Correct.
Okay. So what I did, let's see, my first thought was, because I think you were feeling like really low motivation, low energy, right? And
yep, extremely. It was very hard to stay focused and even just get into anything mentally. It was very hard.
Right. So I think the first thing I did was double your Wellbutrin to 300, and tell me about how's that gone?
That's actually gone very well. I wish I would have realized sooner, because as soon as my dose increased, I was finding myself able to have more motivation to, like, I know this sounds silly, but do simple tasks like take a shower and do laundry again. So I noticed that I was able to, get back up on my feet and start doing that. Not 100% just yet, because, it's still, the work aspect of it is still a scary thing.
Right.
As far as the medication goes, that adjustment really helped to pull me up when I really needed it.
Right.
I was really down.
I mean, the fact that you were on the lowest dose, I'm assuming that means I think I tried increasing it before. It was probably too much before, but that was also a different time and place. And you probably weren't on the dose of Abilify you're on now too.
Yeah, I wasn't.
So that's why I think this is a balancing act with in your case it's a balancing act between the dopamine that was the issue here, and I kind of could tell that by all your symptoms you were having, and I knew it was a dopamine problem. And have you? Then I think we talked about increasing the Abilify from 10 to 15. Have we tried that yet?
Yeah, actually, I'm going to be starting that first thing tomorrow morning.
Okay.
I'm looking forward to it because I have good positive hopes for it. I know that when I did the increase from 5 to 10, that helped. So
yeah, and we'll know. I mean, you'll know next week. If you go from 10 to 15 and it's not clearly better over the next week, then go back to 10. Okay, it's got to be very obvious. Okay. If it's too much, if we go 5 too high on that one, you might feel too tired, too restless, too something. So it's got to be clearly better, and it's possible that 10 will be the right dose. But I think at this point, it's worth tweaking it just one more time to see. Because 15 is even not that high. It also comes in 20 and 30. But the fact that we went from 5 to 10 and 10 was obviously better than 5. Probably at this point, I usually like to say, as long as we've adjusted the Wellbutrin now, we'll do one more adjustment. And if it's not dramatic like the Wellbutrin increase, or if it just if it's not helping you over the next week of doing it, because we have time to figure this out right now because you're not working.
Yeah.
Exactly. And you're going back to work in a week or two, right? Or
in about a week. So the day after next.
Yeah, so we have a week to figure it out before you get back to work. But you're probably going to know within the next 2 to 4 days. So that way, if you're not clearly feeling better at 15, go back to 10, and then you're going to go back to work, and you're going to be doing great. You're going to be back to your old self and your high productivity, and I know the company loves working with you. This is why they thankfully you're using the FMLA for what it's really needed for. And the fact that we were able to do this within 2 weeks is great. Actually within 1 week, because I think when you increase the Wellbutrin, how long was it? 1 day, 2 days, 3 days?
Like 3 days.
Yeah.
I really started noticing it.
Right.
Like you said.
It's usually like 2 to 4 days with the dopamine agents like that. 2 to 4 days. Wellbutrin, 2 to 4 days with Abilify, you probably get a clear, definitely within a week. Abilify might be a little bit slower, but not that much slower. A lot of doctors have this notion that things take a long time to work, and that's just not the case with what I do. People think this notion, it's going to take 4 to 6 weeks to know. No, it doesn't. That's nonsense. That's an old myth, an old wives' tale in psychiatry, is that, you got to give things like months or whatever. It's just ridiculous, which is why it takes people so long to get better, is because when doctors think that and they practice that way, people get frustrated, So, well, good. I'm glad that you're doing better, and I'm really happy.
I couldn't have done it without you. I mean, for the last, it's been almost 20 years that I've been seeing you. You've helped me through some of the hardest times of my life, and right now, once again. So I really appreciate all your help.
Well, again, it's why I love doing it. I love working with people like yourself, because you're a genuine person who needed help, and it's not your fault. I mean, when people have chemical imbalances, I'm sure, I can't remember your family history, but I'm sure your mom or dad probably, or it's family history is what drives it, really. And we can't help our genetics. We can't help our family history. And so that's why, there's no reason to ever be ashamed of this, because it's not something you can help. But thankfully, there's treatment for it, and there's a very effective treatment. And I wish more people like yourself got the treatment they need, because there's way too many people out there that are suffering when they shouldn't be. So
I agree.
Yeah. All right. Well, thank you so much for coming on, and we really appreciate it. And I'll talk to you soon.
All right. Thanks, Dr.
You take care.
Okay. You too. Bye.
So in her case, I've known her for many years, as she said. Affects her. So we got, again, serotonin, norepinephrine, dopamine, GABA. Okay. And those, again, I break it down to these four. It's just an easy way of thinking about this subject. A lot more about this in my books if you want to get more if you want to see more. So in her case, she's been on Effexor. So there we got the serotonin, norepinephrine. We got on Wellbutrin with dopamine. And she was doing okay for a while on those two. But then years ago, things started to change. Her mood started to change. And I identified there was a bipolar element going on with her. She started getting a little bit manic, a little bit more depressed. So I knew right there that we were having, so what I did is I lowered the Wellbutrin down because of that, and I put in some Abilify, which works on dopamine again. But what the difference is, Wellbutrin makes dopamine go faster, and Abilify basically slows it down. So we call it dopamine antagonist. So what it means is it's slowing down. So we got this nice balance between pushing it forward and slowing it down, and that's why I call it balancing dopamine 24/7, because when we combine like that, you get a perfect balance. And without the Abilify, it wouldn't go well. It happened to be in her case that the Wellbutrin ended up being too low, but she was fine for a while. But then she started to have a dip. All I did was double Wellbutrin to 300, which is the average dose, and that just was that boost of dopamine that she needed. And that boost just boom, and she's better, within a few days. So usually 2-3 days is all it takes to know. And now I'm going to basically just see if Abilify a little higher is better or not, and that we'll figure that out really quickly. And she'll be back to work next week. She was doing terribly, and she said probably when I talked to her like a week ago, she said that she's probably ready to go back to work now. I said, well, you got 2 weeks, let's take it. And so, but the fact that she got so better quickly, that's what I call the wow Wellbutrin. That's the power of adjusting things and knowing what to do at the right time. And that just takes experience, a lot of practice. I just keep practicing until I get it right. So, and with medications with people, it's a lot of up and down, tweaking, adjusting. That's the part of it that it's fun. I like it because I have to figure it out, and that's why I love puzzles, and I love the human body is the ultimate puzzle. Hello, welcome.
Thank you. Thanks for having me.
Hey, thank you for coming on. I really, really appreciate it. So yeah, I love how long have you been seeing me at this point?
Oh, I think it's been probably 2.5 years.
Yeah. So share what brought you to the office and what's going on, and kind of what your experience been since then.
Well, basically, I've been dealing with, anxiety for a very long time and depression on and off, and never really took medication when I was younger. Remember my parents used to say, don't worry about things that may never happen. So this has been going on since I was really, really young. And for whatever reason, after COVID, things really escalated. And
right.
I had a case of COVID. And for whatever, and I can't really explain what happened, but those feelings just became way more intense. I had fears of, getting sick and that were really unhealthy. And I went to a bunch of different doctors to try to get treatment, tried to get help, and nothing worked. So the medication that I took, which was just one medication, was fairly effective for me a long time ago. And then post COVID, it really didn't.
What medication was that?
So I think it was called Celexa.
Okay. Yeah.
So. So basically, it just seemed like after COVID, everything changed. And, after seeing many doctors or whatever, luckily I found a therapist who referred me to you. And it took a while for us too, but obviously we mixed medications together, which I was really against and really didn't want to do it. But you kind of encouraged me, and over time we found the right combination, and now I feel better than ever.
Good. And, it's tough because, no one says, I hear it all the time, I don't want to be on so many medications, but I tell people who are on maybe 3, 4, 5, 6 things, hey, if you had high blood pressure, diabetes, cholesterol, heart, okay, you're on 5, 6 things right there. So a lot of things in medicine, we don't really think about it, and people just kind of take it for granted. Okay, well, I guess I have to keep taking these, and they don't really question it. When it comes to anything we call mental or psychiatric or mental illness or whatever, it's just people don't take it as seriously, and they think, oh, I don't want to take pills. I want to just do it naturally, and it's a nice sentiment. It just is not reality. But I think in your case, it took just adding things and trying to figure it out. So you're right now you're on Pristiq, Wellbutrin, Lamictal, Rexulti, and lithium, and like a low dose of lithium. And so with you, it just took a combination of a couple antidepressants with a couple mood stabilizers, and that's really common. Even people, especially with people who have like a persistent depression, anxiety, and who even aren't seriously bipolar, because I think people think bipolar and they think, oh, manic and irrational and paranoid, and well, that's bipolar 1, but there's a lot of very subtle variations of mood, and I call bipolar spectrum when people are when the antidepressants alone just don't completely work, and it takes a combining. And like mood stabilizers, like a little bit of lithium, a little bit of Rexulti, Lamictal. I mean, that's why adding these together is so valuable, because you'd have to understand what you're treating, and that it's not as simple as just a milder depression. In your case, it's been a more chronic issue. It's been more severe, and again, it's. And when you get to that point, it's like of freedom of saying, you know what, I don't care if I have to stay on them. If I can feel the way I'm feeling, like you're feeling now, and I know you're feeling it because we talked about it recently. So what? Might we have to do adjustments here and there? I mean, we might. You're on such a complete mix right now. Probably not. It's very unlikely that we're going to have to adjust anything. If anything, maybe a little bit here and there. But with you, I think long term things are looking really good for you. So
for me, it was really a stigma thing. I just didn't want. I've always been anti-medication. I really didn't want to take anything, and I just would rather just grin and bear it than actually give into it. And I'm so happy that I listened, because there is such a stigma, and it's something that I've always hidden from anybody or everybody, really, including my family. So to be able to, have this type of recovery it's amazing and it's shocking all at the same time.
I'm sure your family's happy too.
They are.
Yeah. But again, I've said this before many times. With men, is particularly, we struggle with stigma, and, it's very difficult for us because of the pride and the macho, and we got to be tough and we have to be strong. And there's growing up, put dirt in the wound and, stop crying like a baby. So with men, as we're growing up, even as boys, we're conditioned to like not complain and not show weakness. And so when we feel that sense inside of us, it's a tough thing to deal with. And thankfully you listened and went through because it's hard to figure it out, because it takes a little bit of trying things. I'm sure we tried things that didn't work, and then we tried things that did work, but it takes you persevering and realizing that's part of the process. It's trial and error. I call it rational trial and error because there is a point, there's a rational basis to what I do, but sometimes it misses. I don't hit the right one. I have to try it again. I have to try to do something else. That's just part of the process. But it takes the person like you who hangs in there with me, and now you're at a I call it normal state. You're at a balanced state, and this is the real you. Actually, this is not a contrived you. This is not a fake you. This is the real you. And it's just you in a healthier state because you have your neurochemicals balanced, and that's all these are doing. If your neurochemicals were not out of balance, these would not do anything for you. The fact that they work means that you do. And again, I forget the details of your family history, but I'm assuming you look at mom and dad, you're going to see some history there, right?
Yeah, I mean, unfortunately I lost a brother to suicide. He was hit by a car when he was 3 years old. And really messed up my mom. And then later in life, he took his own life. And so obviously that shattered our family.
Oh, yeah.
And my parents were divorced, and there was violence and other things that went on. So, I mean, It certainly was not a normal upbringing, but right. I never really thought that any of that would ever impact me, and that I would ever have to worry about it or think about it, when unfortunately those things do impact you.
How old were you when you first started noticing something was not right?
Probably under 10.
Right. And it's usually,
it was early on.
Yeah. And it's usually puberty, which is a little later than 10. In your case, it was younger because of the trauma growing up. And so, so most people will say, oh, I started feeling bad around late elementary school or in middle school because of puberty. But again, when it starts young, like with you, it's just because you have a strong history. Suicide in the brother, that's obviously family history strong right there. There's nothing that destroys a family more than a suicide. There's not even a close second. The divorce rate after suicide of a child is extremely high. Then the family's shattered. And then you have to grow up in that chaos. And so, it's something that's been going on most of your life. So the fact that you're going to take these the rest of your life, which you should, and not worry about it, is because that's the reality. The reality is like, look, I can't help it, so I have to take them. So what? They're safe, they're effective, there's no reason not to, so.
Well, as you had indicated to me, and it was my biggest hurdle was just being able to accept it. And to be able to accept taking all of this and not having it affect me negatively. And obviously, as I started to feel better, I realized that it was the right thing to do.
Right.
I've been to a lot of psychiatrists, and I've talked to a lot of people, and basically, in most cases, they give you 10 minutes. They hand you a pill, and they tell you, if you don't feel good, go to the hospital or whatever. So, and I've had some pretty bad experiences. And, like I said, fortunately, I got referred to you through a third party. And, feel so fortunate that we were able to connect.
Well, it's been a pleasure having you as a patient. And I love what I do, because I love when something like this happens with you, it makes my job. It makes my day. It makes my week. And thankfully I hear it so often. It makes my job just so satisfying and gratifying, because there's nothing a doctor wants more than to see their patients' lives improved. It's why we go into it, and we don't go into it for the money. there's a lot of easier ways of making money. We go into it because we want to change, and it sounds stupid. Like we want to change people's lives. But it's true. It's why we do it. But and what I found when I started as a family doctor and I started in the early 90s, and then by the year 2000 I switched over to doing this full time because I really realized that I could do more good in mental health than I could being a family doctor. Not that I didn't enjoy that, I did, but I knew that this was my calling. I knew that this was where and because during the 90s I learned so much. I learned about mood stabilizers. I learned how to combine them with antidepressants. I learned so much that I decided at that point, I can't keep following the same road. I have to change what I'm doing, and thankfully I did, and otherwise we wouldn't be talking today. So anyway, but thank you for coming on. I really appreciate it.
Oh, it's my pleasure. Thank you.
All right, talk soon. Okay.
All right. Take care. Thank you.
All right. So really good case, this guy. I know him for a couple of years. So here's a case of someone who, again, on Prestige, Wellbutrin, great combo, as you know. If you've been watching the show, I love it. Serotonin, norepinephrine, dopamine. That's good. Great. He was on Celexa before, serotonin only. Not going to last. Not going to be good for the long term. By the way, I apologize for these diagrams. I'm not an artist, obviously. They're kind of messy, but try to get the point across. So, and then with him, a couple of things. I put him on Lamictal, which is a really good antidepressant, and it works on GABA. It's the only antidepressant that works on GABA. And so when someone has a persistent depression despite antidepressants, I think about Lamictal. It's a unique product, and it really helps to stabilize the mood. He's also on Rexulti, which is a mood stabilizer, similar to Abilify, but not quite, a little bit better. So again, now, just like the other case, Wellbutrin pushes it forward, dopamine, and then Rexulti kind of pushes it back. So it just kind of balances that chemical properly. If you don't balance it, it's gonna. If we don't put the Wellbutrin, it's going to be dopamine's this way. And if we only do Rexulti, it doesn't push it that way. So you'd have to just create this balance of dopamine, and that's what I do a lot. And then lithium. Now, lithium is an old drug. Everyone's heard about it. Everyone thinks it's scary. It's not. And in his case, he needed a little bit more stabilization. So since I've already tried Lamictal and Rexulti, and not just Rexulti, Vraylar is really good. Abilify is good. Caplyta is good. There's a lot of them on the market. So I don't mean to advertise for one product. But lithium is kind of just stabilizes the cell membrane. And so with his case, I did a little bit, like a half the average dose of lithium. And then that was the last little piece of the puzzle that put everything together. I don't prescribe a ton of lithium. I think there's better agents out there, but in someone like him, where I'm almost there and I'm not quite, then I start thinking about lithium. I start thinking about Depakote, and that's where with her case, his case. This was the perfect mix, and he'll stay great for a long term. I hope you enjoyed the show today. If you have issues with mental health, or if you know someone who needs help, I'm available. If you want to contact my office, my website is drpaulcoronamd.com. That's DR for doctor. And you can also learn more about me on my website. My phone number, if you want to contact my office directly, is 949-481-0118. If you want to learn more about my methods and what I do, my latest book, I recommend The Corona Protocol, a scientifically proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicide, 30 years in the making. In this book, I tell 30 original short stories about people. And I also have my first 3 books, Healing the Mind and Body, the trilogy, available online. I look forward to you joining me again on the next episode of the Dr. Paul Show.